President Barack Obama addressed the joint session of Congress Wednesday night. You saw there to outline his plan to reform health care. He said he wanted to clear up a few things. Joining us now to discuss and debate and clear up some of these issues as well is Weissman, healthcare campaign coordinator for New Jersey Citizen Action, and Jeff Scheininger, head of the State Chamber of Commerce Healthcare Reform Initiative. And I guess the most controversial thing that we saw that the president was somewhat alluding to, didn't go into detail, is this public option thing, to which you have opposite views on. If we could go to this for a second here. Public option, what is it? Why do you want it?
Well, the public option certainly has caused a lot of controversy over national health care reform. And from my perspective, it is not only important, but actually crucial to making sure that health care reform actually works.
But it puts government in the business competing against private sector, which is a little scary.
For people to understand, define it.
Sure. So the public health insurance plan, as it's called and as it's been defined so far, would be a public option, public health insurance plan created by the government that would compete alongside the private health insurance industry. And so what would happen in effect is that for people who either don't have insurance or don't like their insurance currently, they would have an option beyond just the private health insurance companies. This is incredibly important in bringing down cost in the healthcare system, but also forcing health insurance companies to actually compete. What we've seen across the country is there's a huge lack of competition across many states of insurance companies. In some states, as little as 2 companies control the vast majority of the market. I think the president alluded to in his speech that in Alabama there's 1 insurance company controlling the vast majority of the market. So
Jeff,
kind of an illusion that there's
what's wrong with a little competition?
I think competition is great, and I think the system would benefit from real competition. Eve and I are not that far apart. The problem that you have with the public health care plan as it's been discussed is that the entire system of health care in this country requires that because Medicare and Medicaid reimbursements are so much below the costs that hospitals and physicians incur, there's this cost shifting to private insurers. The private insurers pay more. The health care option, the so-called public option, the government-run health insurance, as it was configured originally by Senator Kennedy, may he rest in peace, was going to reimburse at almost 15% more than the existing Medicare and Medicaid rates to try and address this. It's now been watered down to 10% and on down. Therefore, what ends up happening is if you offer this, as opposed to some other very viable modalities for achieving the very same competitive effect, you end up driving more people into this and underpaying more hospitals and doctors.
I think there are a lot of people, what the president said on Wednesday night is, listen, if you like your insurance, nothing is going to change. But is it not true if, all right, I work for News 12 New Jersey, and if they have companies A, B, and C, and now they've got this public option, they may say, hey, that public option is cheaper, we're going with that, therefore my health insurance does change. So really, can't it change? Is the president not being 100% truthful when he says your health insurance, if you like what you have now, it's not going to change?
I think that the effort is absolutely to craft a bill that will ensure that people can keep what they have if they like it, and that has been a driving principle for it.
But it's
at the very beginning.
Look, I think private insurers are afraid, listen, the government's going to come in lower, and then the businesses are going to say, hey, we're going to be able to save a buck.
I think there's 2 important points here. I think one is that if the private industry, which has had years and years in the business to get this right, and they really have failed us, our healthcare system is in a total crisis right now. If they're able to do this so well, then why are they so scared of competing against a public plan? I think that also the idea that somehow providers are going to not get the reimbursements they need and therefore more cost is going to be passed on to consumers is also a fallacy, because no providers are going to be forced to accept the private plans.
And
if the rates aren't good enough, it won't work.
Private option, there is a difference. If the government gets into competition with the private sector here, the government also regulates through rate regulation, state or federal, whatever it is, whether it's hospitals, doctors, or even insurers on here. If they're competing here, and I guess it's more to Jeff on this one because you don't think the public option really is viable for financial reasons, it seems, on here, but is that an unfair level of competition to have the government now in business against competitors and being able to regulate them through the back door as well? That's a squeeze play in business.
Well, there's already no competition.
Well, here's the deal, though. Eve's not wrong, she's just not right. And the reason for that is as follows. If, in fact, you want to have competition, then let's have competition. Why can't we have these insurance exchanges multi-state? Why must there be only one healthcare company in Alabama, and why won't the president?
Well, Eve, is that a good idea?
No, absolutely not, and I'll tell you why. We are absolutely against having people buy insurance.
Because you don't like you don't want competition?
Because we've gone to great lengths in states like New Jersey to regulate the insurance industry to make sure that they don't have discriminatory practices against people. For example, in many situations, women are charged more for health insurance than men. And so we've gone to great lengths in this state to have a regulated market, not to make it uncompetitive, but to ensure that it's fair and it's equitable and that people aren't being discriminated against. And so if you open up the borders and you just let people go across the states, then somebody might just say, well, I can get this policy for $100 cheaper from Florida. I'm going to get it there, without reading all this fine print and understanding what the implications are down the road.
Except, of course, for the fact that the plans in Congress nationalize and regulate those very issues that Eve is talking about. And that's where you get to the polarization of the argument by people on the extreme left or the extreme right, as opposed to the people who need to be served.
It seems that so many people agree on most of the issues, yet we are at a standstill, a standoff, really. And what do you think is going to become of it? And we'll make this the final question. We'll let Eve and then Jeff answer that.
Well, I still have a lot of hope and a lot of confidence in our elected policymakers and in the American public. Poll after poll has shown that the vast majority of people still do support a public health insurance plan. While I think that it's going to be hard to get this done and get this through Congress, we have every reason to believe that the president will in fact sign a bill with a public health insurance plan. He certainly said that he thinks it's important, if not indispensable. And I just think we need to keep pushing and keep letting our policymakers understand how important this really is and how central it is to making sure reform works.
Again, Eve's not wrong, she's just not right. and
so it's not going to pass, but you can't say it's not going to pass.
Well, I am very hopeful that we will get health care reform, as are most Americans, that will address critical issues. I believe that both parties, if they ignore the extremes in both parties, agree on about 90% of this.
All right, but the public option, up or down, you think, by the end of the day?
Down.
Okay, very good. Thanks, guys. And we can see what the differences here between you two guys. Very good on this one, even Jeff. Okay.